Dr. Wachter has been very outspoken about his confidence in the vaccines that are coming our way. He's feeling very positive about it, but he also expects that there will be plenty of bumps on the road. He wants to point them out now before the first shipment gets here.
Neither the CDC nor the state of California are likely to get more granular than to say healthcare workers and people over 65 in long-term care facilities are the first two groups.
The question then becomes which healthcare worker goes first. Take UCSF, which is unlikely to get enough vaccines in the first shipment to cover their entire staff of 30,000. The very complicated task of deciding which employee gets the vaccine first then falls on the hospital's management team.
We then have to internally say, okay, who goes first, who goes second? What we will say is the group that's going to go first are people, frontline clinicians, nurses, doctors, respiratory therapists, transporters.
In a series of 24 tweets, Dr. Wachter outlined his concerns about the distribution of vaccines. The one that really keeps him up at night, misinformation.
There will be thousands of people that get a vaccine and in a month or two they have a heart attack, or in a month or two they have a stroke, or in a month or two they come down with cancer. Has zero to do with the vaccines. That has to be absolutely clear.
Dr. Wachter says he worries these stories will be used to discredit vaccines even after they've been approved by the FDA and despite undergoing rigorous clinical trials. He says the messaging has to be clear and consistent from the president to local health officials.
We've got to have a really, really vigorous, effective anti-misinformation campaign. And judging by how we blew it on masks, that makes me very worried.
The UK is the first country to approve a fully tested COVID-19 vaccine. They're expected to start giving out shots starting next week.
What we learned from the UK is about the same scale as California in terms of size and does not have the complexity of trying to figure out how you do this across 50 states and 330 million people. But there's certainly going to be lessons from the UK, and we should learn from them.
So Dr. Wachter also added that community leaders should help with communication of vaccine information and that health officials need to reach out to influencers to help spread their message.